On the reserve side, we're here primarily to diagnose oral pathology and disease. A typical day here in our clinic, patients come in, they obtain a blood pressure and complete a medical history, which we then review with the member. And that blood pressure screen can be really helpful to identify anyone that's pre-hypertensive so that we can refer them appropriately if needed. And then we'll review x-rays just so that we can evaluate their oral health holistically and complete comprehensive extraoral and intraoral exams. If you are looking to become a dental officer, then you would have to obtain a DMD or a DDS degree from a civilian program. On the enlisted side, once they're assigned to dental, they'll attend a 9-week course at Fort Sam in Houston, Texas, which is just a crash course on kind of the basics of dentistry and helps them acquire some basic knowledge and skills that will allow them to further hone and develop those skills in a clinical capacity. The roles of the clinical dentist are to prescribe x-rays, and those are to help us identify oral pathology and oral diseases, the most common being dental caries. And you have your general dentist dealing with common things like cavities and crowns. Some duties that we might find on the enlisted side as a dental assistant would be front desk duties of calling and confirming patients and assisting with coordination of care amongst the different specialists that might be a part of the clinic. Our enlisted members are vital to coordinating that care. They actually are the ones that generally acquire all of our x-rays. They're the ones that set up and clean up for all of our procedures, and they are the patient's advocate. Generally, they're the ones that are providing post-op instructions and really getting that one-on-one time with our patients. We're an open door policy. I want people to know that they are welcome to come down anytime. We are here to support them and to be a resource, whether it's a second opinion, preventative education for themselves or their family members. I just love getting to know the airmen. After 6 months, you'd recognize a patient, and although you can't always acknowledge that you know them or how you know them, it's just fun to get to know those members on a more personal level when they are here in the chair.